Good morning once again from Center for Advanced Studies in Rijeka. My colleague Marko Luka-Zupčić and I will host you for this occasion, welcoming our guest, Barbara Prainsack from the University of Vienna and King's College London. Vedran Džihić, our director here in CAS, will moderate the session, and he will actually introduce our speaker. But before that, I just need to tell you once again that we very much look forward to welcome you all in Rijeka, and especially on the island of Cres, where the University of Rijeka has new premises, Moïse Palace, a Renaissance building, which it's the main purpose will be educational and also dedicated to the civil society, developing civil society at the island of Cres. Barbara and Vedran, it's up to you to continue now. Thank you.
Okay, thank you so much, Sanja. Good morning from, as you already have heard, from not so sunny Vienna, but it's not raining either, so it's fine. So I'm very happy to introduce Barbara Prainsack. We have known each other. I mean, we still have to discuss it to see when we met for the first time, but I believe it was like 15 years ago at least, probably at the University of Vienna, when we were trying to finish our PhDs. And we managed somehow in the meantime. A lot has happened, obviously, in the last 15 years, but I mean, we are still young. That has not changed.
It was 20 years ago, Vedran.
Was it 20 years ago?
I'm sorry to say.
Yeah. It's no, Barbara, but that's even better. I mean, we are still young. That's fine. Look at us. And in the meantime, also Barbara went to Great Britain, accepted the professorship at King's College London. But then the desire to come back to Vienna was so strong that she, a few years ago, decided to accept an invitation to took over professorship at the University of Vienna. She is a professor at the Department of Political Science, and at the same time still keeping her affiliation with King's College London. Barbara has published, I mean, those introductions basically, so you just need to Google Barbara and then you will get Barbara, and you can read Barbara. So she has published a lot on wide range of topics related to social, ethical dimensions of biomedicine, bioscience. She has worked on personalized and precision medicine, citizen participation, and recently, and this is what I want to underline, and this is basically the background for today's meeting and then the workshop and seminar. She has worked a lot on solidarity, both in terms of how to conceptualize and to think and rethink solidarity in times that we live in, but also in terms of quite empirical. A lot of empirical research related to solidarity. She has, and this is what you might want to check up, she has established a Center for the Study of Contemporary Solidarity at the University of Vienna. And I'm just underlining the importance of the center and of the topic, as in the network that we have in Southeastern Europe, we also invest a lot of time, precisely also in Belgrade, but also in Rijeka, trying to understand, conceptualize, and research the implications of solidarity and political or democratic engagement. So Center of the Study of Contemporary Solidarity is offering a lot, having scholars, publications, so you can check it up at the University of Vienna webpage. And recently, and this is also one of the backgrounds for today's seminar, Barbara has been engaged in 2 research projects on COVID or post-COVID. I don't know if we can say post-COVID, but it's still definitely COVID when we look to Latin America, Africa, but particularly also to Southeastern Europe. As in the last few weeks or days, we have have been experiencing the rising numbers of infections in North Macedonia, also in Bosnia, and particularly in Serbia. So a lot is still going on. In any case, there are two new research projects run by Barbara. One of them is comparative and longitudinal study on solidarity and COVID, and this is where we from the broader network try to join it, and we are quite hopeful that we will manage soon. Anyway, I'll stop here. Barbara has a PowerPoint presentation, and Barbara, the Zoom and the lake, obviously, and the mountains behind you, everything belongs to you, but we are, the audience, the Zoom audience is listening, and we are very much looking forward. Thank you so much for joining us.
Thank you very much for the kind invitation. I'm very, very happy to and honored to speak here. The lecture series is famous, so I'm really honored. And thank you also, Vedran, for the kind introduction. So as Vedran indicated already, I'm really a health policy person, not a political scientist in the sense that many people, at least in this country, understand. I'm at King's College London. I have been at the Department for Global Health and Social Medicine. So my solidarity work really comes from a health perspective, and I'm still very interested in health. And I think recently, I guess, the developments before and around Corona have radicalized many of us and have also shown, and this is, I think, one of the main findings also from our Corona projects, how Claire Bambara recently called it a syndemic perspective on a pandemic. What does she mean by that, and what do we mean by that? We really see in the context of Corona that that social, economic, and biological factors mutually enhance each other and interact to create cumulative outcomes. So we see that people with worse health status are affected more strongly by the virus, are also affected more strongly by social and economic effects of the crisis, and that in turn decreases their health. So it's a kind of loop of factors that we are and effects that we're seeing here. So why am I saying this? I think if you are a health person, as we are, if one is a health person, one needs to have a much broader view. And the World Health Organization speaks of health in all policies. Of course, Viennese people have a long history of health in all policies. The whole social housing movement in the beginning of the 20th century was a health in all policies movement already. So I think we are bridging policy fields now, and I'm also pleading with every one of you who's not already interested in health, but if you're working on housing policy, on democracy, look at health as well. I think this is one of the things that we learn also from Corona. Okay, so this was a kind of long introduction. What am I going to do today? I will speak for about 35 minutes. I'm going to start, and hopefully this will not be boring to you. I'm going to start with some theoretically minded explanations of what our approach to solidarity is. So there will be a bit of a theoretical beginning. Then I will go into some of the empirical findings that Vedran kindly mentioned, that we have of two studies that are currently carried out, not at the University of Vienna, but one at the University of Vienna, and the other one is coordinated here and comprises nine countries now, and hopefully also will have some of you participating in it. I'll talk about that later. So the starting point of our work has been that I would love to, if we have time to discuss this, I would love to hear what your experience has been. But in my parts of the world, in the beginning of the Corona crisis, solidarity was all over the place in terms of a programmatic statement. So everyone's talked about solidarity at the level of global health, collaboration. People also talked about solidarity in terms of neighbors, going shopping for each other, intergenerational solidarity. There's also a European solidarity tracker, as you can see on this slide here. So there were celebrations of solidarity all over the place. And of course, the question is for somebody who's already doing work on solidarity, is what we are seeing here, is this solidarity? Is it something else? And going forward, since the beginning of the crisis, what has the crisis done to solidarity? This is also what I'm going how I'm going to structure my talk. So I will first, as I warned you, say a few things about our conceptual understanding of solidarity, then start to answer the empirical question, do we see it? How do we see it? And then how is the crisis affecting solidarity? And I will conclude with that. And I will not give a definitive answer because the crisis is not over, as you already mentioned also, Vedran. But I think I will sketch what I think an answer could look like. So I think it is rather curious that solidarity has relatively little systematic attention in the social sciences. Although there are lots of instances, and here is just a random collection of media reports of people who, especially also in political science, are of course conceived as ideal, typically rational, bounded actors who operate in a self-interested way. And with our lives, our social and political lives are full of stories of people who behave altruistically, as it is often called. Sometimes it's a little bit less altruistic than others, but in many, many cases, people take huge risks, and some of that we have seen now in the Corona crisis, to support others who are not their friends or their family members. So this is one thing already that I want to highlight about solidarity. I think solidarity conceptually is not very useful when we apply it to support within families, support within parents and children who often love each other, or even solidarity among couples and close friends. I think solidarity is most useful where there are no stronger bonds that explain mutual support or support. So this is a preface. So again, we find a lot of empirical evidence for human altruism. So I'm careful with the use altruism, the use of the word altruism, for reasons that I will explain in a moment. But the thing that I would like to highlight here is that in social psychology, even in behavioral economics, over and over, we are confronted with the empirical finding that the rational actor paradigm is being challenged by behavior that is not self-serving and not self-interesting, but it is actually other regarding, and sometimes even other regarding, to the extent that people put their own well-being and their own interests at risk. So we are ontologically, human beings are in a situation of interdependence, not only at the beginning of our lives and at the end of our lives, but throughout our lives. And against this background, it is quite surprising that solidarity, as I mentioned earlier, plays relatively little systematic role in social science research. Of course, I'm not the first person who highlights this. Others have done so, and I will show some of the important critiques of that in a moment. But let's look into some of the reasons of why solidarity has received, I mean, it has a lot of attention in a kind of programmatic way, but not in a way where solidarity is actually operationalized to understand why certain practices emerge and how certain practices emerge, and how we can understand policies and institutions from a solidaristic perspective. So why is there relatively little attention? Well, one obvious reason is that in many parts of the world, in Eastern Europe, but also in places outside of Europe, there are, of course, historical experiences with oppression and human rights infringements in the name of solidarity. So I have lots of colleagues, especially in Eastern Europe, who are not particularly fond of the term. So, and I fully understand that. That goes some way in explaining, in answering the question, but not fully, of course. I think an even more important explanation for why solidarity has very little currency in social science research is what many have called methodological individualism. So there's a deep methodological individualism in Western thought. And that methodological individualism has, of course, also is connected to the influence of the rational choice paradigm in Western social science. What do I mean by methodological individualism? What I mean by that is that the way that we structure social and political space is through individuals. So the individual actor is the central unit of agency in a lot of social science work. And some of you might even think, yeah, what else, right? If it's not the individual, what else should it be? But this, I think, only shows how entrenched this understanding of individual agency is. So individual agency is not the only way to structure social and political space. And in order to show what I mean by this, because this is so far very abstract talk, is that, of course, feminist theory, feminist economics, and also the care ethics approach. And here I just want to highlight one book by Catriona McKenzie and Natalie Stoljar has challenged methodological individualism as not only masculinist, because, you know, the idea is that typically individuals are ideally independent from others and bounded, and they have sort of strong boundaries that separate them from others, which, as feminists have argued, is fundamentally different from the life experiences of many women, and not only women, I would argue. So women, of course, are in a way an extreme case, because when women give birth, they are also physically not always singular, but they are dual and not clearly bounded. So what McKenzie and Stoljar argue is that instead of having a kind of individualistic understanding of autonomy, in the sense that we become fully autonomous by being free from dependency of others, maybe we should understand autonomy as relational autonomy, meaning that through our connections to others, and others are not only humans, connections to our human, natural and artifactual environments even, we become fully autonomous. So obviously, if I just put it out there like this, there are problems involved. It could be seen as neglecting or even justifying oppression. These concerns have been responded to by these scholars and by a wider range of scholars. And I would like to bracket these concerns off for now, not because they're not important, but because in a way they are a different discussion to have. The key point here is that I think a relational approach to autonomy as one that understands human beings as autonomous also because of our relations to our environments is one that is very fruitful, and one that defeats the term of altruism in a way. And this is actually a point that I owe to Marilyn Strathern. She came to one of our workshops on solidarity in the Nuffield Council Solidarity Project, where she made this point, and I actually I sort of used the solidarity and altruism interchangeably, and she said, altruism is deeply couched in a dualistic worldview where I'm either interested in myself and self-serving, or I am oriented towards others But altruism is a disposition towards the world. I can be the last person in the world and be an altruist. But I cannot be the last person in the world and be solidaristic, because solidarity is a relational practice. Solidarity requires another. Solidarity is something that needs to be received in order to materialize. Okay, so there's a lot of theoretical work on how we can overcome methodological individualism, and I think this is it's a very profound task for social scientists, actually. It's not a trivial thing, it's not just an academic thing. But how do we do that in practice? And here, very briefly, I will zoom through our own work on solidarity. I already mentioned the Nuffield Council on Bioethics, as together with the Art and Humanities Research Council in the UK that funded our early work on this, where we did a lit review on literature that was out there on solidarity, mostly English literature, but we included some Dutch and German literature as well. But this is by no means comprehensive, because there's lots of work out there on solidarity also in Spanish, which we did not look at for this project. So I'm aware of the caveats, but building upon scholarship that was available to us, decades of scholarship, we suggested to understand solidarity first and foremost as a practice, namely a practice that reflects commitments to accept costs, quote unquote, to support others with whom we recognize a similarity in a relevant respect. So this is a very wordy definition, but it's important. And I will just make a few qualifications. So the costs are not only financial costs, as indicated on the slide. Any kind of social, emotional, and other investment could be seen as a cost. So, and also this recognition with others. So saying that I support others with whom I recognize some similarity in a relevant respect, that is not the mere recognition of some essentialist, objectively existing similarities, such as that Vedran and I are both Viennese, and some of us are women, and so on. But we recognize what we have learned to recognize. We recognize what we've been socialized into recognizing. So everyone who lives in a post-conflict society knows how quickly this can change, what we learn to recognize as other. Okay, so solidarity in our approach is not merely an inner sentiment. It needs an outer expression. It is not only a value. It is, and again, this is in the spirit of what Marilyn Strathern said, and in the spirit of relational autonomy. It is not self-directed or other-directed. It's always both. And this actually emerges already from a practice epistemology. So practice is a way of meaningfully engaging with the world. And if I engage in practice, I'm making myself and I'm making others, right? So it's always self and other directed. People are inseparable from their social relations, their relations to the environments. And the key point about solidarity is, and this sets solidarity apart from other pro-social practice. So what gives rise to action in solidarity is symmetry. So I recognize something that I have in common with you, and this gives rise to action. And it doesn't mean that I'm like you in every respect. It's not an approach that says people are all the same and we all love each other and we hold hands. This is not it. But despite the differences between you and I, in a situation, I recognize similarities, and those similarities give rise to action. So for example, you are losing your job during the Corona crisis. I have some experience with it, either from myself or from people close to me. And because of this similarity of seeing myself in you, or seeing part of my life in you, I support you. I fight for your employment rights. I'm happy to, or I donate money, or whatever it is. So charity, for example, which is also a pro-social practice, what gives rise to action in charity is actually asymmetry, right? I'm rich, you're poor, or the other way around, and I give because I have a religious duty, a moral duty. But solidarity is different in that symmetry here gives rise to action. So there's lots of discussion about the role of reciprocity in solidarity. This is the last theoretical slide that I show, the last conceptual slide. In our own conceptualization, we distinguish the three tiers, where we have the interpersonal level, tier 1, which is, you know, I'm recognizing something of me in you. I donate money, I donate an organ, I do something else to support you, I demonstrate whatever. So if this interpersonal practice becomes common at the level of groups, if it becomes normal practice at the level of a group, it becomes tier 2 solidarity. And once it becomes so, it solidifies, it's actually a beautiful English word for this, once it solidifies into bureaucratic legal and contractual norms, we speak of tier 3 solidarity. And this is the level of solidaristic institutions, progressive taxation, universal healthcare, and so on. And of course, the more reciprocity we have in a system, the more stable those solidaristic institutions are. By this, I mean indirect reciprocity. I don't mean tit-for-tat reciprocity. If I do something for you because you do something for me tomorrow, that's not solidarity, that's a business transaction. Or it's love or friendship, right? But if I pay more, if I pay tax happily, knowing that I will support other people because now I have a job and others do not, but also knowing that the day after tomorrow, if I have an accident, I will be receiving support from this system. Maybe not from the same insurance, not from the same pot, but from the community that I pay in. This community will also pay out. That's indirect reciprocity. And the more indirect reciprocity there is, the more stable those solidaristic institutions are. So this slide shows what a solidaristic approach can offer, but I'm also aware of time. I said that I wouldn't speak for too long, so I will skip over this slide and go to the empirical question. So what do we see in this crisis, in this pandemic? Do we see solidarity? And here I will focus, although we have a study that is a 9-country study so far, and hopefully including more countries soon. Also in the qualitative findings of the 9-country studies, I will focus on Austria today. Because of the time we have available, and also because we're in the middle of data analysis yet, and I know the Austrian results the best. We have, as Vedran kindly mentioned, we have two projects. One on the left here, you see the Austrian Corona Panel Project, which is a project that was conceived and started by Bernhard Kittel, together with Silvia Kritzinger, Hajo Baumgarten, and myself at the University of Vienna. Lots and lots of people at the University of Vienna and beyond are helping, are driving this. I shouldn't only say helping, but are doing this. We publish several times a week. We publish findings in German of our surveys, and we survey a representative sample of Austrians every week. And every 2 weeks, we publish a summary in English as well. And I will later on put the link into the chat. So that's the Corona Panel Project, the Quant one. The Qual one on the right-hand side is one that Katharina Kieslich and I at the Center for the Study of Contemporary Solidarity are leading. You see a wonderful list of institutions. So we have 9 European countries participating so far, and we are doing in-depth qualitative interviews with people in 9 countries at 2 time points. Time point 1 was during the lockdown or during the strict measures in place in April. Time point 2 will be October. And if you have any questions about those projects, I will be happy to answer them. So what have we found so far? Unsurprisingly, we have found that that Corona has really made Austria more unequal. And when I say this, sometimes colleagues say, rightly so, yes, we know this is what every crisis does. But I insist that this is not a trivial finding, in the sense that it shows how, as I said earlier, using Claire Bambara and colleagues, a term of the syndemic pandemic, that different factors of deprivation in different areas are cumulative. So, as I mentioned at the beginning of my talk, those who are worse off economically are also worse off in terms of health, and so on, and so on, and so on, and it exacerbates each other. Second, the one normative finding, that the normative implication of our findings is really that if certain people enter the crisis with worse social and economic resources than others, and if those fall further behind in a crisis, then the political implication should be to tackle social and economic inequalities in a sustainable manner. Institutional reform, redistribution, and pre-distribution. I would love to talk more about pre-distribution if we have time in the discussion. So pre-distribution, as you know, is measures that form wealth before it even accumulates at individual levels, and before it's being redistributed. So pre-distribution measures are a good education system, so that people don't have to have money in order to get education, access to affordable and good housing, because then you don't need to be rich to buy a house, so you don't need to be rich to get a mortgage. So those are pre-distribution measures. And I think the one implication worldwide from the corona crisis, in countries that have had it good so far, as Austria, so far we've gotten through it quite okay compared to other countries, and also countries that have it bad. The implication is we need pre-distribution. So we need better public services. We need more investment into public infrastructures. This is why I keep emphasizing that this is not a trivial finding. But let me tell you a little bit more about what we actually found. And I will just, forgive me, I will just rush through some of the findings to give you an overview. And I'm happy to go into the specific findings later on if anything is of particular interest. So I already mentioned those with lower incomes have been hit harder by layoffs. So Austria has an institution that is called Kurzarbeit. There's no perfect English translation for that. It's something that collective bargaining has achieved, which means that it's not a furlough, because it means that you get 80% of your salary and you work fewer hours. But it means that people don't actually lose their jobs right away in a time of crisis. So many people have benefited from that. Those with lower levels of education were most likely to lose their jobs, to not go into Kurzarbeit, but to actually lose their jobs. Those with low incomes have had further income losses during the crisis. So those with very confined spaces, the average household size in Austria is not very small. So Austrians have between 26 square meters and 70 square meters per person. This is not bad on average. So 26 to 70 is a number that emerges from different household sizes. So if you live in a single household, you have on average 70 square meters for yourself. And if you live with more people, you have on average 26, which is still not bad, but of course it's very unevenly distributed. So we found that 20% of all children actually spent the lockdown in confined spaces. Similar pattern, 88% of Austrians have access to outside space and had access to outside space during the lockdown. But among the 12% that do not, surprise, surprise, it's the urban poor. So those people who also often have larger family sizes, or people who live in poverty, elderly people in poverty, have no access to outside space. Domestic conflict, families with children, especially those with more children, who also tend to have less space per person, have more conflicts. And now I'm moving from those socioeconomic standards, circumstances to the political, and then I'll get back to socioeconomic circumstances in terms of gender, which is the other thing I would like to highlight. So these things are happening, the country is becoming more unequal. Another big finding that we had is that Austrians overall love the government. So the political scientists among you will immediately say, yes, of course, rally around the flag effect, we know that. We know it from times of war. This is an international phenomenon. When there are wars, when there are conflict, the rally around the flag effect signifies that leaders experience high levels of support, even from those who didn't vote for them. This is indeed something that is not new. And it's actually more remarkable that in the United Kingdom and in the US, approval ratings are relatively low. That's the real surprise, not that approval ratings in other countries are high. But in Austria, it's very high. So 70% of the people still think the measures are fantastic. Quite a significant proportion a large proportion of Austrians believe that the most important job of a journalist is to support the government, that opposition parties should hold back with criticism of the government, and that parliamentary control of the government should be limited at times of crisis. So I don't need to say much about that, right? So Austrians like to point their finger at Hungary. We should also point the finger at ourselves, I would say. So there are some authoritarian trends that are quite concerning. And of course, this is not the majority, but there's a significant proportion. And if you're interested in the specific numbers, as I said, I will show you the link in the chat. In terms of solidarity, there are relatively high levels of solidarity within Austria. So how do we establish that? We have found throughout the crisis, from the beginning to now the lockdown is over, many things have gone back to normal, and of course not in terms of economic recovery, but in terms of what people can do. We find consistently that those who consider their own health risks to be low leave the house as little or as much as those who consider the health risks to be high. And now, this is not a quant data. If we look into the qual data, people actually say that many people say, I'm not really worried about myself, I'm restricting myself because of others. We have people who say, I don't want to go to work in a supermarket or in a hospital, but I'll do it because I think it's my duty. So relatively high levels of solidarity, and this does not wane. We haven't found a downward trend, although in the abstract, we found that fewer people now say that there's a lot of social cohesion than at the beginning of the crisis. But there are probably other explanations for that, which I won't go into that. What we do not find is solidarity across borders. So Austrians, for example, think that Austria should have the opportunity to limit exports of goods that are needed in times of crisis, but they don't want other countries to have the same right. Austrians, and when I say Austrians, I'm talking obviously not about everyone, but I'm talking about the general trends that we found. But I think you know that. Austrians are not in support of paying more money or increasing EU contributions in order to support other EU countries with their own mitigation measures. Whereas inside of Austria, quite a number of people are in favor of wealth taxes, even wealth taxes that affect themselves. So even those who would be affected, so the people in higher socioeconomic strata and higher incomes, they would and more wealth would still be in favor of a wealth tax. So this is of course something that we also know from crises, in and out group polarization. In some ways, one could say it's maybe not surprising that we have people in Austria being more solidaristic to the inside and less solidaristic to the outside. But given that we've also been part of the European Union since 1994, I think this is not a given that outgroup is other European countries. I think that's quite a sad statement also. So my final point before I come to my conclusion, my final point is one thing where we see that the crisis really has a horrible effect is gender equality. And Austria, as you know, as you may know, has not been a super world leader of gender equality to start with, but it has gotten worse. Childcare responsibilities, household chores are mostly taken by women. Interestingly, this is maybe a fun fact on the side, women complain more than men. Less than men, men complain more than women. But the burden is really borne mostly by women, and I think we need to highlight that as well. Okay, so in the interest of time, I will end here. I will maybe just conclude with one finding that draws our empirical findings back to our conceptual understanding of solidarity, and that is that, I just go back quickly to these tiers. We find evidence that tier 1 and tier 2 solidarity, so solidarity from one person to another, one neighbor to another neighbor, teacher to students. You know, the teacher is worried about her health, but she still teaches, although she could not go in. People who go to COVID stations, COVID departments in hospitals as nurses or doctors, although they could also refuse to do so. We see relatively high levels of solidarity there. Some people say it's declining, maybe it's declining a little bit, but we have no indication that there's a huge decline going on. Where I expect lasting changes are tier 3. And this could go either way. Either people think, you know, everyone should fend for themselves and we should continue to carve out and hollow out solidaristic institutions as, you know, the last government at least has clearly done. And hopefully this one will not. But it could also go the other way. It could also be that people take this greater need for social equality quite seriously. A lot of people see that. We see that also in our qualitative study. Lots of people mention it. And the rich and the poor mention it. The very privileged with household incomes of 3,000 and far above, but also people with household incomes of 1,500 and below. They see that and they want to change it. Whether there will be the political will and the sustained pressure to do so, to go more strongly into redistribution and predistribution in terms of also institutional changes and changes of lasting policies and not only punctual measures, temporary measures, this remains to be seen. So tier 1, tier 2, we see solidarity, this is in conclusion, we see solidarity within the country, not very much outside. We see the classical in-group, out-group polarization along population groups and also population groups in terms of age, also most of the categories that the government communicates, so the old against the young. We see a little bit of that, but overall within Austria there's still high levels of solidarity at tier 1 and 2. Tier 3 is where I expect in the middle run and in the long run where I expect the changes, and it could go either way. Okay, so, oops. Yeah, I think that was it. So thank you very much for listening, and I look forward to hearing your experiences and your views. And I'll stop sharing now.
Thank you so much, Barbara. That was great. I mean, first of all, as sometimes at least that's the impression that I have, we have those like separated spheres within the academia. those guys discussing theory, terms, doing conceptual work, and then the others doing some empirical research on the other side. And what we definitely in terms of solidarity need precisely in the region of Southeastern Europe is both a kind of a very precise definition of what we research or what we speak about when we speak about solidarity. What do we speak about when we speak about democracy? What do we speak about when we speak about social equality, etc., etc.? And at the same time, we need empirical research. And this is why we try to join you in looking, I mean, taking your experiences from Austria to Southeastern Europe. I'm quite afraid that whatever, I mean, but you have underlined those inequalities, structural inequalities, gender inequalities, political authoritarian tendencies, that this is going to hit the region of Southeastern Europe particularly very, very hard. When I just think about the political consequences, those authoritarian tendencies are quite widespread. I mean, now Serbia, for example, where Gazela and Jelena and many others have joined us today, is going to have elections on Sunday, 21st, in the middle of pandemics, with one party and one man dominating the show, and basically trying to generate support for authoritarian type of regime. And it was quite also, I mean, that would be an interesting question for the research, for the empirical research, to ask whether those that support governing parties have been hit harder or not so hard, because we have those clientelistic structures that are distributing public goods. And my assumption would be, for example, that members of the Serbian Progressive Party, for example, haven't been hit that hard by the corona crisis, but rather the political opponents or those belonging to oppositional parties. So this is a kind of an additional moment. But anyway, let's open it up for comments and for questions. I mean, the easiest is, as long as we see you, you just wave. And if you want to comment or pose a question to Barbara, otherwise there is also this digital Zoom tool, raising hands. You can use whatever you want. Jelena Vasiljevic from Belgrade, she decided to go the classical way, just raising the real hand. So Jelena, the Zoom is yours for your question.
Thank you. Can you hear me? Well, first of all, Barbara, thank you very much. I really enjoyed your talk. And I myself, I started working on solidarity a couple of years ago, and I was so amazed even before hearing your lecture when I looked at your webpage. It's that we have many similar approaches to solidarity. I was also trying to work on really making sketches on a theory of solidarity, and also was very interested in how to differentiate solidarity from other types of pro-social behavior, and we came to some very similar conclusions, even though we used different references, but it was really interesting. And I will try to be coherent if I can, because I made some notes, and I was interested both in your theoretical and your empirical parts of your talk. So I'll just go through my notes and try to kind of connect different things that I want to say. At the very beginning, you said how this everyone talked about solidarity, how solidarity was a hot topic, not only at the beginning of pandemic, but I also noted that solidarity recently has become sort of a buzzword. Everybody talked during the refugee crisis, during the economic crisis, like it became really a big topic. And on the other hand, it's been so rarely theorized in theory, so that there's this discrepancy between how frequently we talk about solidarity and how little we write about it in theories. But that also raised an interest, at least for me, not only in solidaristic behavior, but also in the rhetoric of solidarity. And I find that this rhetoric of solidarity is, because it's indispensable for any political agenda, because rhetoric of solidarity is a very powerful tool for articulating and more importantly, for legitimizing political agendas. So I was also very interested in exploring how different political agendas used solidarity reasoning. This is what my latest article I wrote about, the solidarity reasoning, and how different citizenship agendas, for instance, in post-Yugoslav states, used different solidarity reasoning to legitimize very concrete agendas. And that is because I think solidarity has this, solidarity is always about we, a certain we, it's about a group. And I think that also goes to what you said, that that altruism is about a dualism and solidarity is a relational practice, and I really agree. But I would also maybe add to this that it's a group-related phenomenon, that solidarity always needs a group, it solidifies a certain we, and it's also directed towards another group. And it's and also because of this group dimension, there is also a political dimension to solidarity. And I believe that solidarity really has something political. It's a political notion. It has a political potential, at least. And that's also connects to another thing you said, that for you, solidarity is about practices. And it's also about it's aimed towards those with whom we share to those we see as similar, to those who are similar. But I would also say that not only to those that we see as similar, but to those that we see that share similar goals or values. So they don't have to be similar. So for instance, people going to Spanish Civil War is volunteering and things like that. So people fighting for common goals. So there's also additional proof that there's a political element in it. Fighting for similar goals is what drives solidaristic actions. And also your point about symmetry, it's also something I also thought about and have written about. That's very important, that solidarity always implies a certain struggle for symmetry between different groups. And not only that, in this respect, it is different from charity. So not only the problem with other altruistic behaviors and empathic behaviors like charity, for example, is not only that asymmetry is involved, it's also that, for instance, charity legitimizes this asymmetry. It justifies asymmetry. So it's okay for me to be rich because I actually contribute to poor. So whereas solidarity is always a kind of a struggle to eliminate this asymmetric relation. It's a struggle for symmetry. So again, this political dimension for me is something that is very important. And in this respect, I draw on literature from Hannah Arendt, who wrote in her book on revolution. So there's a small passage where she kind of defines solidarity as a political disposition, and also books from Schultz and others who talk about political solidarity. They differentiate other aspects, but I think that solidarity in itself is a very political notion. And this last thing you said about in your empirical parts of your presentation is also very, very interesting, when you said that there's no solidarity across borders during coronavirus. There's no readiness for people to be solidary across borders. That's also a topic that was very interesting for me, this tension between citizenship and solidarity. Because in my previous work, I wrote a lot on citizenship, and I was primarily interested in these conceptual and theoretical tensions between the notions of solidarity and citizenship, because citizenship needs solidarity. Every idea on citizenship, it's always a question of a community, political community, we need solidarity. On the other hand, conceptually, solidarity is about transgressing borders. It's about being solidary with different groups. It's not about having borders. So it's how they work together, the synergy. There is something paradoxical about this unity of solidarity and citizenship, which is very, very interesting. And also it gets interesting in times of crisis. For example, sometimes we are very much ready to cross borders and to help others, to go even to wars, like I said, like in Spanish Civil War, and sometimes we want solidarity to keep home. And I think that's also a very, very crucial question in respect to migrants and to refugees. So are we ready to share our solidarity resources with others, or do we want some old school welfare state institutions, institutionalized solidarity, but only for us? So how do we define us and them? So I think that all these issues is really, it's really helpful to look at them and to research them through the perspective of solidarity, which is something that we do, and I think it's extremely important. So thank you again. It's not really, I don't really have a question, I just have a bunch of comments, so sorry about my verbal diarrhea, sorry.
No, this is fantastic, Elena. You should come visit us when we can do this again. I would love to read your article about different solidarity perspectives.
Reasoning, I can send it to you.
Please, because I was just looking it up also while you were speaking, but I don't think I could find it. So I will.
Elena, can you just share it in the chat if you have some links that are free available? That would be an interesting.
I will, but I don't think it's open. I don't. I'll send
okay.
you.
If you manage it, because there are probably other
just
guys.
one remark on my side. If we find the finances, Elena will actually work with us in this project together with you. So I think you will have a lot of opportunities to.
Good. So I will just. I took a lot of notes, as you may have seen. So I will just pick two things to respond to, because, as you were saying, Jelena, most of what you said were insights into your work and amendments and nuances that you added. So one clarification, when I speak of solidarity entailing the recognition of similarities in a relevant respect, then a shared goal or a shared experience of oppression or whatever, that could of course be I mean, the example that you gave is exactly what we're talking about as well. So it doesn't need to be a characteristic, but it could be a shared political goal, a shared personal goal. So what we mean by similarity in a relevant respect is that the context of practice determines what the relevant respect is. This is why I think it's so important to conceive of solidarity as a practice and not as an abstract thing. Because if I'm, let's assume I'm a lesbian woman in a country who makes homosexuality a crime, then the similarity in the relevant respect will be very much that in the context of women being attacked for their sexual orientation. Whereas if I am then together with other women at home, my solidarity might be with those who support my own views vis-a-vis social inequalities and vis-a-vis racial justice and so on. So the ways in which we enact solidarity and with whom we enact solidarity and with whom we even feel we have a similarity in common is not only shaped by what we have learned to recognize, but also by the practical context. And a shared goal, as you mentioned, is absolutely a paradigmatic case of something that we would call a similarity in a relevant respect. So I think here we're in agreement. So the other point that I wanted to pick out is citizenship and solidarity. I find this one of the, you put your finger on one of the most interesting aspects, I think. I'm very ambivalent about that, especially in healthcare. Citizenship plays a problematic role because, you know, I lived in the UK for 10 years. When I moved there, everyone who was on the territory could get healthcare. Now it's changing in that sometimes people are refused healthcare if they're not residents, legal residents in the UK. But that was actually, the UK was one of the few countries, of course, because of the beverage system, the beverage heritage, and not the Bismarck heritage, that didn't tie healthcare to citizenship or to having worked in a country. So the way that healthcare services are organized in terms of national, within national borders, within national boundaries, even if access does not always correspond with citizenship, healthcare is something that the nation state provides. So that is one of the good things about it, but it's also one of the difficult things about it. Because when we talk about exclusion, we usually talk about exclusion from healthcare services and have the US in mind, where some people are not insured, but we exclude lots of people as well. In Austria and in every country that has a Bismarck system, we're excluding migrants. In many countries, such as in Austria, also migrants would then be eligible for emergency healthcare, but they don't have the same entitlements as others. So I think citizenship is a problematic concept, especially when it's understood as a kind of national citizenship, a citizenship that that entails entitlements towards a specific state. At the same time, and this is what Wilhelm Litzka writes about, it is also an opportunity to provide and guarantee institutions that are solidaristic versus smaller, more particularistic groups that would sort of self-organize, and that by definition are exclusive, and that by definition are often organized along ethnic, religious, and other lines that are much more nativist than a territorial state. And this is just something I want to highlight because it has been very, very thought-provoking for me. The way that Klimlicka writes about multiculturalism and the nation state is very interesting. He more or less says that because of the neoliberal trajectories, multiculturalism has never been understood as inclusivity in political participation and economic participation, but it has become a kind of market participation. Multiculturalism is, you know, having access to cool music and ethnic cuisines. So multiculturalism is something that you consume. And the providers of multiculturalisms, namely the others are accepted as my fellow citizens, as providers of those services that I can consume. But it doesn't go deeper than that. So I think there are hundreds and hundreds of ways in which citizenship, nationality cut across solidaristic practices and structures in good and in bad ways. So I think this is one of the most interesting frontiers now in solidarity scholarship, how it intersects with citizenship.
Thanks, Jelena. Thanks, Barbara. I see we have to set up the financing and come together quite soon to discuss the solidarity and citizenship, but also other aspects. So any other hands? Yes, I see Bojana.
Hello, and thank you very much for this opportunity. I enjoyed your talk very much. It is related to what I'm studying. I'm also a researcher at the Institute for Philosophy and Social Theory, as Jelena and Gazelle and Delia here. So my interest is on philanthropy, and I'm trying to understand what empirically in Serbia. So I have 3 comments, or let's say 2 comments and 1 question. My first comment relates to the reasons why solidarity has not been studied as much as it should within social sciences. And it occurred to me while you were talking that perhaps there is a 4th reason as well. It is, and I think it is from ideological reasons. So when you talk about solidaristic institutions, which certainly need to be financed through taxes, it does not go well with the neoliberal ideology which has been predominant. So I would say that this might be another reason to think about why solidarity was neglected, particularly this 3rd layer or 3rd tier of solidarity. My second comment is about altruism and solidarity. I also struggled to understand the relationship between philanthropy and altruism. And what helped me is to make a distinction between 3 forms or 3 types of altruism. Altruism in evolutionary sense, altruism in motivational sense, and altruism in behavioral sense. And then I can say that philanthropy, and I think it's the same with solidarity, can be said that it is altruistic behavior, but not necessarily done out of altruistic motivation. And then we avoid this egoistic, altruistic dichotomy. And finally, my question, my main concern is about how to measure solidarity or philanthropy. So when you say someone can donate money or give money to an unemployed person because she understands what does it mean to be unemployed, and because that's why she sees this similarity between the unemployed person and herself, and this is a form of solidarity. Mm-hmm. And this kind of let's say symmetrical relation. But then if she gives to the unemployed because, let's say, I don't know, maybe she just feels sorry for this person, she never felt anything similar or experienced anything similar, this might be charity or philanthropy. But then we cannot know this if we only observe the behavior. So how I try to overcome this when I studied philanthropy in Serbia, I simply didn't talk about philanthropy, but I just tried to use technical words like, do you give money to a person or do you give your time to someone? And then try to understand the reasons behind. So my question is, what methodology is appropriate here to study these phenomena? So thank you very much.
Thank you very much, Bojana. I start with the second question because that's easier for me to respond to. Philanthropy, yeah, I'll get to that in a moment. You're absolutely right, we cannot look at behavior to understand solidarity. So, and I immediately say, let's not use the word behavior. Behavior is, again, a term that is couched in an individualistic worldview. That behavior is something that people choose. Behavior is something that is bounded. It's something that can be stimulated. And you know, people who look at behavior are the people who ask the question, do values shape behavior, or does behavior shape values? Well, practice includes both. Practice shows that what we do enacts values, and our values are also enacted. So practice is something that does away with the Western dualism between thinking and acting. It does away with the idea that thinking precedes acting, which is, I think, really a very bad baggage that we have from some sort of Enlightenment philosophy, and as feminist scholars would say, masculinist economics. So if we use the word practice, we'll already start to ask other questions. And when we conceive solidarity as practice, and every meaningful engagement with the world is practice, then we would immediately say we cannot just look at what people do and say, okay, you're being solidaristic, and you, Vedran, you only help because you think somebody else will help you tomorrow, right? We don't know, so we have to kind of look into people's heads. And that is the answer to the methodological question. So what we do is we really do interviews. This is one of the reasons why the 9-country study is not a survey study, but it's an interview study where we can actually ask people, okay, you say you do this or you don't do this. Why? Explain to us when you last did it. What did you think while you were doing it? And so on, what were the implications? So we actually have to talk to people and understand their practice in order to be able to say that their adherence to a specific measure is solidaristic or not. Because also tax paying. So I sometimes get asked by people, yeah, you call progressive taxation solidaristic, but you know, I just pay my taxes because otherwise I'll get a fine. And of course that's true. So progressive taxation is solidarity at the institutional level, but whether you or I enact solidarity in tax terms by paying taxes at level 1 depends on what meanings we attach to our tax paying. If I do this, if I don't cheat, if I do it happily because I think I want to contribute to those who cannot help themselves at this moment, then I pay tax out of solidaristic reasons. If somebody does it because they fear a fine, they don't do it for solidaristic reasons. But this is why the tier system makes sense. So something that is solidarity at tier 3 is not necessarily solidarity at tier 1. And also, not every tier 1 solidarity solidifies into tier 3. So that's one thing. Methodology is absolutely yes, with the addition that I would not use the term behavior. I use it sometimes in my publications because I know otherwise reviewers shoot it down, but whenever I can avoid it, I avoid it. So philanthropy, and I will be very quick. Philanthropy, I think, I always thought, I'm not an expert on this at all, drawing upon the work of my friend and colleague Lindsay McGoy, who wrote this fantastic book that I'm sure you know, No Such Thing as a Free Gift. Philanthropy is a kind of business practice, right? It's a practice of tax avoidance of large corporations. This is, but you might have a different understanding of philanthropy.
Bojana, you want to jump in? Just to quickly reply. Yes.
Just to jump in, when I talk about, I just, perhaps I should have said that I'm interested in individual philanthropy. So why you and me help our neighbors or donate to a local nonprofit and similar. So yes, I would agree with you that this philanthropy on this level of foundations or corporate philanthropy is a business.
No, absolutely, you're absolutely right. Thank you. Then it was indeed a semantic issue. So, okay, that. Then I would say that philanthropy at the individual level, or at the level of the person, I'm being a pain in the neck today with terminology, but individual, as George Orwell said, should never be a noun. The person, at the level of people, of individual persons, I think this would fall within the larger realm of charity, right? Charity without the religious connotation. So charity, I would say, would be characterized by asymmetry. Did I understand you right? So also philanthropy, yeah. So I'm rich, you're poor, I give to you, right? And instead of putting it into the into the stock market, I donate money to my community. That's what you mean, right?
Well, just quickly, there can be many, let's say, reasons or motives behind. So not necessarily just to choose between paying taxes or donating to charity, but I would say it's very that's the, let's say, scholars who study solidarity and those who study philanthropy should, let's say, read each other, because sometimes I can see a kind of bias towards one or the other, but basically on this, let's say, basic level, there are many more similarities, particularly when we talk about this tier one solidarity or personal philanthropy, as you said. So I'm very grateful for this opportunity and to learn more about your project, because it's very relevant to what I'm studying. So
thank you. And I take your point that we should, the people who work on solidarity should read more on philanthropy. And I admit that I was just biased here because I just subsumed it under corporate philanthropy. So thank you, Bojana.
Thank you very much.
So thank you, Bojana. Who wants to jump in from, Liliana?
Sorry for interrupting. We have one raised blue electronic hand.
Okay.
Katarina is first. I'm sorry.
Thank you, and thank you very much for the talk. It was very interesting. I have one question, and it would be like, would you say that solidarity can actually be taught, in the sense that when you employ a certain public narrative that promotes solidarity practices, because we have actually had this during the Corona crisis, that politicians, but also media and so on, they really said, like, we have to be solidary with each other in order for this crisis to be overcome. So do you think that we can actually teach people some kind of solidarity, or that at least we can promote this kind of solidarity also on certain narratives that refer to certain similarities or common goals that we have, and then this solidarity can better be enforced?
I think,
Barbara, may I just suggest, I'm looking at the time, it's 11:20. So it will be probably the best way to proceed if we collect like additional 2 or 3 comments, then we just bundle it and you try to answer it by the end. So I would say if Liliana could now take the Zoom and pose her question, and we see if there are any other real or virtual hands, and we proceed. Liliana, you have to unmute yourself.
I am. I'm trying. There we go.
That's good. That's good.
Can you hear me now? Awesome. Okay, well, thank you first for this amazing talk. I'm also from the Institute of Philosophy and Social Theory in Belgrade, as my colleagues are. So what got me interested in your talk is when you use the concept of syndemic pandemic, or actually syndemics in general. I'm a medical anthropologist, just to give a few backgrounds. So I think that's actually a really good way to think through the pandemic. So it got me questioning to the relationship between syndemics and solidarity. So right, if you're finding ways to see solidarity as a symmetrical approach, but syndemics shows us that always it's a case of a disease, or in this case, the pandemic has several variables or several factors influencing it. So if you're finding similarities with someone based on, say, gender, are there any drawbacks to looking at solidarity through one particular variable and how it affects it if we're looking at a syndemic approach? I don't know if you're understanding what I'm trying to say here. At best, is that sort of if we look at just one aspect of, in this case, the pandemic, so say you're relating to someone based on their class or their income status, but they also have other syndemic variables that are affecting their situation. Can solidarity actually have its drawbacks? Or should we maybe start thinking about something along the lines of a syndemic form of thinking through solidarity, so through different lenses, not just the different tiers?
I have one question for clarification, Liliana.
Please.
Why would it have drawbacks? So
I don't know. I'm questioning if it has drawbacks, right? If you're looking at trying to help someone based on one particular variable, say, as I said, economic status, and you're not looking into it in a syndemic way, the way in which, do you understand what I mean? So are there possible, have you seen it in your findings? I'm just thinking through it. Because as we know, when we study healthcare, if you're targeting, say, TB, and you're only looking at tuberculosis and you're not looking at other underlying, like, social, economic, structural violence issues, you're really not solving the problem, but only tackling it from one aspect, and actually has several drawbacks that go into it. So that's one thing. And during your talk with Bojan and Jelena, I came to sort of thinking about consumerism and solidarity. So can solidarity, and I think maybe it's more related now to what Jelena was talking about, this rhetoric of solidarity. Are we starting to see sort of this notion of being solidaristic as a form of consumption as well? You mentioned it when you talked about multiculturalism as something that's being rather consumed rather than practiced. Should we be worried about consuming solidarity rather than practicing solidarity on particularly maybe this intergovernmental level or something like that? And that's it. I really enjoyed the talk.
Thanks, Liliana. Any other real or Zoom hand? No. Okay, Barbara. Oh yes, there is a one small real hand. Tanya.
Hi. Sorry, this is more of a less a question than a comment. It basically just thinking about how we were discussing the way in which the nation state is affecting solidarity in your research. I think part of what might be interesting to think about is that all of these measures were taken at the level of the nation state. So borders were closed, which is a really new way for at least the EU to think about things again. So the reclosing of borders, the remaking of borders in this sense. And that sort of the EU has always struggled with re-embedding the market in a sort of Polanyi sense because all of these solidaristic forms of, social welfare, but social institutionalized solidarity tend to function on the level of the nation state. So maybe that would be just an interesting thing to keep conceptually. I think Martin Hoppner wrote some stuff about this, so it might be helpful.
Thank you so much. Yeah. Now back to
Yes, and I will make sure that we end on time. So I'm looking at the clock. Thank you. This was fantastic. First, so it was very helpful for me. Thank you for that, Tanya. Yes, I this is how I would describe it. I think that part of the focus on the nation state is because of the nation state, or the territorial state, we should say, being the key actor here. And I think that's, as I said earlier, I think that's not only bad, because I put into the chat this medium story. So this is one thing that we, together with my husband, actually, we wrote about what the new normal should look like. And here we have a big role for the territorial state as a creator of public money. So we think that the core of institutional reform should be a reappropriation of money by the public. So this is a very different discussion. But I would love to hear what you think if you have time to. It's a bit of a longish read, but I would love to hear it. So I think, yes, fully agree with Tanya, and I think I also agree with this needing much, much more thought. The good and the bad roles that nation states can play in not only fostering or destroying solidarity and determining the boundaries of solidarity, but also in creating the institutions that in turn can foster solidarity. Katharina, can solidarity be taught? Yes, I think it can be, because I think socialization is teaching solidarity already. And I think this is what you also hinted at, or actually what you said. You said, I give you an example. The example that I always use for something that we learn to recognize is overweight people. Whether we are overweight ourselves or not, the very notion that some people are overweight and these are the other, and now overweight people should be excluded from certain healthcare services, and they are, in the UK, they are excluded from certain elective healthcare services, requires that we first create something such as the body mass index, and we make it measurable. So there's a whole apparatus around it. So of course it can be taught. It can be taught, we can all be taught that we see what we can measure, that what can't be counted, it doesn't count. And that, even raising children and teaching them how to talk about people who look different, who act different. I think this is teaching solidarity. When I mean teaching solidarity, I don't mean so much telling people to be nice to others. That's also important, but that's not what I mean. I think you actually mentioned the key thing. Teaching solidarity is like, it's teaching how to other and how not to other. And so I have 1 minute left. Liliana, this was there was so much in there. And I would just pick out one thing, but I took a lot of notes here as well. I think solidarity can cut both ways when we have a syndemic perspective. On the one hand, solidaristic institutions such as universal healthcare or social housing or education, they will benefit everyone, and especially measures of pre-distribution actually also are lend themselves less to othering, because once you redistribute capital that has already accumulated, you say, okay, you're the free rider, you're the scrounger. But if we have pre-distribution where things are distributed before things accumulate, it lends itself less to othering. So on the one hand, solidarity helps, and it improves the fate and the situation of those less privileged. But of course, solidarity can, if it's a particularistic, exclusive kind of solidarity, it can exclude others from our gaze and from our actions and from our support. So if I'm only looking at the health of women, or only the health of another group that is in need of improvement, then of course I will exclude others. And I think that the most important thing, and Nick Rose and other colleagues have a forthcoming paper, I think in Theory, Culture and Society, maybe it's even out, where they say we need a theory of, they don't use the word syndemic, but we need a theory of interaction of different factors, and not just a statement that everything is connected and everything is multifactorial, but we need a theory of that, and they draw upon Nancy Krieger and so on. So, but solidarity can cut both ways, yes. For me, as you have noticed, solidarity is not only a positive practice. If I'm a white supremacist and you are my white supremacist friend, we can be solidaristic within a group. But of course, as soon as we go to the societal dimension, certain types of solidarity will have other effects than others, and then we need other substantive values, such as justice, such as equality, such as inclusiveness, that complement our system to create solidaristic institutions that are actually good. So it's 1 minute past half. I'm sorry. Thank you.
Thank you so much, Barbara. That was really amazing. Should we clap the hands?
Thank you.
I mean, Barbara, we know we stopped clapping the hands because the Serbian president Vučić, in the middle of the pandemic, started having Zoom meetings with hundreds of people watching him, and you will only hear them when they clap and support him. Otherwise, there will be no interaction. So basically, we just wave or send kisses. But sending kisses, just to end on that note, I'm so enthusiastic and so happy that you joined us. And what we have just experienced in front of our eyes in the last 1.5 hours is basically laying ground for new collaborations and really connecting dots. And at the same time, it was a kind of exercise in intellectual and academic free solidarity among transcending borders. So thank you so much for this one. Thank you also for, I mean, the school How to Other and Not to Other. We will set it up. It will be probably in Sarajevo or somewhere else, but that will be an amazing idea to have a school for how to other and not to other. Where it's supposed to be?
On the island.
On the island. I mean, obviously, the island of Cres. And last but not least, I mean, at your first slide, you showed the solidarity tracker of the European Council on Foreign Relations. And it was quite interesting that you would on the tracker see a lot of lines cutting throughout Southeastern Europe, but not touching Southeastern Europe. So there were no dots in Southeastern Europe, which is basically also kind of suggesting us how some processes of exclusion or inclusion within Europe or equalities and inequalities are renegotiated. So we need to close those solidarity dots. Barbara, thank you so much once again. We will give our best to and you have seen now a few faces, Gazela, Jelena, Liliana, and many others who will definitely be part of the research project that we want to establish and join you in your efforts. So it will be amazing, and we look forward. We hope and keep our fingers crossed that we will get the finances. If this is a charity organization, a big one that is a capitalistic one and gives us the money, we will probably accept it, huh? I don't know. Let's see. Discuss it then. And now back to Sanja and Luca to send us some sun and make some concluding remarks from Rijeka.
I wrote in our chat, no time limits, Barbara, but then you as a trained scholar, you just follow the line. Both of us, we are philosophers and very much enjoyed what we've heard. And we will spare some comments and questions for another occasion. And when I said the island, I didn't, it was not a joke, really. Because thinking I'm having another workshop mapping the locality in a sense of really experiencing on an island, which is always isolated geographically. It's an isolated area, and you you have different practices of solidarity.
Yeah.
So these practices of solidarity are extremely interesting. I'm not even thinking of Robinson Crusoe. It's not the narrative, but islanders' ways of practicing solidarity is different. And I do look forward, again, inviting you, all of you, to join us. I look forward to organize an event or a workshop on the very topic of mapping the locality of solidarity, and not only crossing borders, not only among citizenships or differences on that multicultural levels, but concretely on the very spot of having the sea around us and us in the middle of a beautiful, beautiful island. So thank you very much to all of you. And as I said, very joyfully looking forward to our meeting, next meeting in physical spaces. Wishing you all the very best for the rest of the day. That was it.
Thank you so much, everyone.
Thank you.
Thank you.
Bye.
Thank you. Thank you, Vedran, for arranging it.
Thank you. Kisses to all of you. Bye, guys.
Bye.